There's no question that the private practice physician is slowly disappearing. More and more medical doctors are working in group practices or in hospital-affiliated or owned practices. The fairly recent rise of dental service organizations, or DSOs, may herald the same trend for dentistry. I'll be back after the break to discuss the pros and cons of joining a DSO. Colin here, and welcome to this episode of the Patient Attraction Podcast. Now, data from the ADA indicates that group practices increased nearly 2,000% from 1992 to 2007. More recent data indicates that larger practices continue to erode the share of total receipts of smaller practices. With the economies of scale that group practices can enjoy, the private practice dentist may be at a competitive disadvantage in many respects. The same is certainly true for corporate dentistry. It's hard to scale a sole practitioner to compete on price. In fact, it's impossible. There's indications that recent dental school graduates, many of whom are carrying hundreds upon hundreds of $1,000s in debt, are choosing to go into corporate dentistry. Some people see DSOs as being at least a partial solution to the challenge of big box corporate dentistry and competing against it, whereas others see DSOs as not much different from the corporate boys. Now, the dental service organization as an entity is a fairly new development, but they do offer a number of advantages. First off, they can handle non-clinical functions such as accounting, marketing, legal matters, and human resources, which frees up the dentist to do what the dentist loves to do, treat patients. Now, I don't know any dentist that wouldn't like to get rid of the business side of their practice. And just like group practices, DSOs can also establish a network of specialists instead of referring patients out. Now, that all sounds pretty good, but what are the downsides of a DSO? Well, DSOs usually, but not always, represent an investment of capital on the part of the dentist. Now, with that investment can come pressure from allied dentists to meet patient quotas and to recommend procedures with higher profit margins. A 2014 survey by Columbia University College of Dental Medicine found that of graduates who had worked in DSOs, roughly 1/3 had experienced those financial pressures. And, like all areas of medicine, there have been some bad actors in DSOs who have run afoul with the law. So what's the bottom line? If you value your independence above all, a DSO isn't for you. But if you would prefer to be rid of the practice management and responsibilities and just focus on treating patients, a DSO might be a solution for you. Now, here in this short podcast, I can only scratch the surface of this issue. And like any business decision, your due diligence and caution are vital for making a wise and informed decision. If you have interest, my friend Woody Oakes is working with a lot of DSOs, setting them up and helping people manage them right now. Now, tomorrow's podcast will focus on measuring your dental marketing ROI. And until then, keep moving forward.